What is the youngest patient that you have treated?
5 hours old. She came out of the womb and I almost adjusted her right away, but then they had to take her away for like tests and all that, and I was so tired. I adjusted her after 5 hours because think about, why do babies need to get adjusted? Usually, natural birth. We're not even talking about the vacuum suction forceps. We're talking about just natural birth. They're pulling 30 to 60 pounds of force on the baby's head. Oh, that's not that much, 30 to 60 pounds. Imagine this, you hang a baby upside down and then you hang a 30-pound weight on their head. Does that seem like a lot? That's a ton. Why do babies come out like this sometimes? Their neck is all messed up, right? 30 to 60 pounds, that's just naturally being pulled. Our birthing process is flawed because most ladies lay on their backs. No other animal or mammal does that. Any other mammal that either walks or are on fours have their baby standing up on fours using gravity. The best way to have a child, right? It's almost like a squatting position. Squatting, kneeling position, holding on to something, right? Using gravity. The other thing is when you're laying down, your sacrum, your tailbone is completely on the bed. It's flat. When it's flat, it can't pulse. If it can't pulse, your pelvis can't open up. So now what happens? Your pelvis can't open. What happens to the baby's blood pressure, heart rate? It starts dropping, right? Oh no, emergency. Baby's not doing well, right? Let's go in and stick a needle on the baby's head so we can check the heartbeat. Or better yet, it's not doing well. We need to shoot you up with Pitocin, which sounds like the other oxytocin that helps you pump, okay? Pitocin forces it. So now you're in so much pain. Oh, mom, you're in pain? I got something. I got an epidural for you, so you can't feel anything now. Oh, and all of a sudden, the baby's heart rate drops because you shot it up with drugs. And they're gonna tell you, oh no, it's okay. The baby's not gonna feel anything. There's no way. You're telling me a mom gets on crack and the baby gets affected, but you shoot it up with epidural and the baby's not gonna feel anything? Yeah, baby's heart rate drop. Now, failure to thrive, all kinds of problems. Oh, guess what? Time for emergency C-section. Boom, emergency C-section. Now what happens? The baby doesn't go through the birthing canal, right? The natural squishing of the canal, getting the baby out, gets the brain activated, all right? Coming out of the vaginal canal gets the bacteria of mom on the baby, good bacteria, develop good gut flora. The squeezing of their chest gets the water out of the lungs, okay? Those are like just three that I could think of off the top of my head that's good for vaginal birth. But C-section, baby comes out, oh, round head, all that. Baby can't breathe. Why can't breathe? All the water's filled with lungs. I mean, your lungs are full of water. Your lungs are full of water, right? The baby can't really scream and cry. Let's go smack the baby a couple times. Oh, now we're gonna suck the water out, right? And then the brain doesn't get developed. And then now the child has terrible immune system because it never got the mom's immune system. The first thing they do is take the baby, see? And that's what happens, right? That's what happens. We've adjusted multiple kids.